I think the key is what we've learned over the years is when you track and you involve the team, the awareness is there. Okay, so they're tracking manually each day how many no-shows, cancellations, and open units. That's what equals the downtime. The second metric that cannot be measured through automation is case acceptance. And a big reason for this is practices that go chartless. I never call it paperless because there's always some paper, chartless. When you treatment plan a solution to a diagnosis, if you have nowhere to write all the different options in a paper chart, then all your treatment plan solutions need to be entered in the computer. So what happens is we go in and run outstanding dentistry reports, or we go in and run treatment plan reports. They're millions and millions of dollars because every option the doctor suggested is entered in the computer. There's no way, computers haven't figured out, the softwares haven't figured out a way to take what's completed versus what. It's going to come. Some smart brain's going to figure it out. But I remember go ahead.
Cleardent has an option where you can post the treatment as pending or accepted or completed. Yeah.
Right. So that's a good point. So pending, accepted. So what are the three things? It was pending, which means planned.
Yeah, completed. Yeah.
Actually, the list is really
it's a really long list.
Yeah, so here's your thing. Garbage in is garbage out. See, what you're going to be depending on is every human keystroke is going to keep that accurate, and sometimes that can be overwhelming. But here's the thing with case acceptance. You don't need to track everything that's accepted. What's most important for you to track is your major dentistry. The dentistry that's a bit more of a challenge outside of benefits with their insurance benefits. That's usually what practices track. Also, you want to track is what is the treatment planning of each new patient that comes in. That's your dollar per patient, and that helps you make decisions on your marketing budget. So I can spend $20,000 on a direct mail campaign, getting my website going, SEO, search engine optimizations, right? Have my digital footprint and my paper program in place. The toughest challenge about marketing is it's unpredictable. And I don't like unpredictable things. Only because you like to be able to plan what's going to happen. I've seen the same thing in marketing be done in 5 places in this country and have completely different return on investment. So I think creating your marketing plan, when you track your dollars of treatment planning that are coming from each new patient, you get what's called a new patient ARP, a new patient revenue, average revenue per patient on your growth factor. Do you remember how to calculate your ARP on your existing patients? You remember that formula? Real simple. You take your gross production divided by your what? Active patients. And that's what's called your average or annual revenue per patient. On new patients, though, to track your marketing efforts and your return, obviously you want to know where the new patients came from. Okay, that referral source is pretty important. I think today the challenge in tracking referral sources, you could have word of mouth come up as your number one referral source. However, what happens when I tell you about a great person? What's the first thing you're going to do? You're going to Google it. Really, regardless of what generation you are. Because everyone knows how to type letters into Google, it seems like. So when you're tracking your referral source, you're tracking your treatment planning on each patient, that comes part of your tracking devices, part of your metrics that you want to track. If we go down the list here, we look at, now I'm combining the whole practice here from a big perspective of all the 25 metrics. I just want you not to leave here and wonder what this means, okay? So if you look at the patient count, your active patient count, how many active patients do we need for 32 hours of dentistry for a dentist? Remember?
15 to 18.
Yeah, 16 to 1,800 in a well-oiled machine. If you're running like a Hail Mary in total chaos, you're going to need more. Because a lot of them, we're going to talk about capacity engine we're getting into after the break today. A lot of patients, the patients falling through the crack in this country of your practices is significant. And when they're not attached and they fall through the cracks of their practice, they have the temptation to choose other providers. Or those of you who do calls, no calls or contacts no. Everyone we let leave the practice without their next appointments, 1 to 3 hours of harassment in some way, shape, or form to try to find them again. The most common thing you'll hear from Canadian patients, and this isn't really any of your fault, it's called decades of training them because they're a model of us, is, well, you didn't call me. And your inside voice wants to say, well, you're a grown adult, can't you manage your own appointment? You have a whole dialogue that goes on when they say that. But we've trained them so much to chase them for their unscheduled hygiene. And we're going to talk about, I have a guest speaker coming for you next session that's awesome. It's automating an entire recall system in a practice. So instead of us trying to change the practice management softwares, leave that alone. Now the smart brains are putting add-ons to your practice management to pull out relevant data. Okay, question?
No, we have the report.
Yes.
So,
Yeah.
yeah.
Yeah, and it's interesting. It's there's so much functionality in there. People that have it even don't even realize how much it can do to manage your system. Auto messaging, we'll talk about that in a little bit. That's probably a fact of life of dentistry today. We didn't always say that over the years, but auto messaging, and I'll explain why. So your active patient count, new patients, COEs. There's two types of new patients. One comes in for what? A comprehensive oral evaluation. One comes in maybe because of an emergency. So it's important to clarify, is this a new patient looking for a new dental home, or is this a patient in a delirious state that you're the only one open on Saturday mornings? Okay, and you'll find out really quick. What's our goal with emergency patients is to convert them into forever patients. Okay, not steal them. Okay, that's not what I mean. But if they're coming to you for an emergency state, unless they have a raving experience or they even know or remember who their dental office is, the goal would be to convert them into, what is a COE? Comprehensive oral evaluation. So a comprehensive oral evaluation is generally ideally done on the first visit for obvious reasons. Nowhere else in healthcare could a patient call and say, hi, I need a colonoscopy. Can you book me tomorrow? Or, hi, I need a root canal. You wouldn't even do it with restorative. Hi, I need a root canal. Can you put me in the dentist's schedule? What is always the same answer going to be? There's no way to confirm the treatment that you require until we've done a full assessment to understand your needs and to do an oral health complete exam. Okay, so when you look at COEs as an acronym or a jargon that we use, and that really just means their comprehensive oral evaluation. 01103, well, a lot of you call it new patient exam. In Ontario, there isn't a new patient exam definition. It's a complete oral evaluation. Where else would you do maybe complete oral evaluations is on your patients of record. Okay, it's like a dental physical, for lack of a better way to say it, to connect it to the rest of healthcare. It's like a dental physical. So when you look at tracking this, patient attritions, put a big star here. Patient attrition, we have a challenge in this country because Canadians are so nice, they don't always tell you when they're breaking up with you until after you find out, okay? And patient attrition it's really important. We can have all the marketing in the world bring in people through the front door, but if we're losing them through the back, okay, so keeping your active patient data up to date is really, really critical, and you're knowing what your active patients are each month, okay? So you've got your active patients, how many new, how many went out the back door, and then you've got your net growth factor. But I'm telling you, well, I said put an asterisk, patient attrition is the least tracked anywhere. And oftentimes, without knowing that, you have a false sense of how many patients are loyal to you and how many patients you want to retain. So active patient interval is what? Within 2 years. Now, you're going to hear different people say, you know, how many, like the brokers do, how many patients have been in the last year. That's because it pumps up the value, just so you know. Some people do every 18 months. The interval isn't so much what's important. It's just knowing what's just apples to apples, okay? We use 2 years because generally if someone could have fallen out of your practice for 2 years, but they still, when asked who their dentist is, they still say you. Okay, so we want to look at what's their interval you're going to use. I just wanted to give you a heads up. You're going to hear, it's not about someone's right, someone's wrong. It's just the date span is the date span. And when do you start it? When do you end it? If you want to see how many are in the first year, what do you do to get your active patients? You'd assume that there'd be double coming for 2 years. Okay, but that's if they attend their retention or their interval as recommended. Okay, age demographic. We talked about this a little bit. I think I've mentioned this with knowing our different generations of patients. Now, practice management softwares, they generally print out ages in decade segments. They don't exactly follow, it doesn't follow exactly these generational intervals, okay? But knowing the variety of generations you have, knowing the age of your patient, this is a great thing to know. Why? Why would you think it's important? Why would we want to know where we're starting with our generations of our patient base? Any ideas?
Marketing.
Marketing, okay. Target, where you're going to target. So, you know, it's great to say I want new patients, but if your new patient campaign gets you 500 children and children make you crazy and annoyed and irritated, you're not going to be happy. So it helps you see, what are we treating now? It also shows you your level of modification to your contact methods, right? Because, you know, we know a certain generation likes email, a certain generation likes texting, right? There's the millennials who don't believe in voicemail. I just was somewhere yesterday and we called 4 millennials trying to find out an answer. One of them said, I don't do voice, text, or I am me. So I said to the person, is I am a new term? They said that's called instant message me. Okay, so one thing I will tell you, when you see the automation next, when we're together again, is a really beneficial application is two-way texting. Two-way texting is really showing a huge impact because a patient might not answer your call or they might not have time to talk to you, but two-way texting, and there's not a lot of systems that can do that. As far as add-ons, because the two-way, literally I could text you and say, hi, where are you? I have a cancellation tomorrow at 11, or change in schedule, excuse me, tomorrow at 11. Do you want to take it? And the patient can literally be texting you back.
We have that.
You have that too? Yeah. You find it works well?
Yeah, it's good.
Yeah, so it gives them a chance to interject. The text I get from my eye doctor saying you're due for your eye exam and I don't wear glasses. I'm not sure where they found me. I'm a little bit perplexed by this, my next thing to research. But I keep getting these texts, you're due for your eye exam, and I don't know how they got me on their radar. They must be having an add-on auto messaging. I must have went there at one time in the last 10 years. So the emailing and the texting isn't still the only answer. Okay. However, we've got to have a variety of communication. And a lot of reasons is because of the mobile world and because of the generations that don't even have landlines.